Introduction. Menopause is a very natural phenomenon that occurs to older women when their menstruation comes to a stop. If a woman, usually in the age group of 45 to 55, has not menstruated in 12 consecutive months, then she is said to have menopause. Menopause brings with it an array of symptoms such as hot flashes, weight gain, postmenopausal skin irritations, etc. Menopause can also cause depression and insomnia. A study by the Centers for Disease Control and Prevention (CDC) in the USA showed that postmenopausal women aged 40 to 59 have more trouble falling asleep than premenopausal women of this age group. Menopausal complications can be kept at bay by some simple measures. Let's discuss menopause in details in today's video. What is menopause? Menopause is a natural cessation of menstruation that occurs in middle-aged women who are between 45 and 55 years old. This age limit can vary by a few years, depending on various statistics. Most women go into menopause without proper knowledge about it. Many menopausal women refrain from seeking medical advice for their symptoms, but that is not advisable, as these symptoms can sometimes become serious conditions that affect your body. How long can menopause last? Most women first begin developing menopause symptoms about 4 years before their last period. Symptoms often continue for about 4 more years after a woman's last period. Causes. Menopause is a very normal process that occurs as the ovaries age and produces less reproductive hormones. As a woman reaches her 40s, her body begins to experience some changes due to the low levels of estrogen, progesterone, follicle-stimulating hormones, etc. During menopause, women lose their active ovarian follicles, and as a result, they lose reproductive capacity. Symptoms. Menopausal symptoms can be physical as well as mental. We need to let you know about these so you can deal with them easily and effectively. Stress, anxiety, and depression, and problems in focusing. Heat flashes, night sweats, weight gain and loss in muscle elasticity, onset of osteoporosis, vaginal dryness, and loss of intimacy. Perimenopause, menopause, and postmenopause. Perimenopause is the time during which your body starts slowly transitioning towards menopause. During perimenopause, menstrual periods become irregular. Your periods may be late, or you may completely skip one or more periods. Menstrual flow may also become heavier or lighter. Menopause is defined as lack of menstruation for 1 full year. Postmenopause refers to the years after menopause has occurred. This is the time when your symptoms can start affecting your health. Changes in the body during menopause. There are many ways in which your body can begin transitioning after menopause. Menopause is an entirely hormone-mediated process, and there might be fluctuations of hormonal levels in your body during this time. Reduced level of estrogen can decrease your libido, but that does not mean you cannot have intercourse in your postmenopausal period. Postmenopausal fatigue. Your testosterone levels are also lowered. As a result of this, you may feel tired after finishing your day's work. Low progesterone levels during menopause can cause breast tenderness, anxiety, period changes, etc. Other than these symptoms, postmenopausal life is nothing scary. A survey has said that 80% of women have agreed that menopause did not decrease the quality of their lives. Complications during menopause. Menopause is usually pretty simple, but you can still have some knowledge about the common complications stemming from this phenomenon. Vulvovaginal atrophy, dyspareunia or painful intercourse, slower metabolic functions, osteoporosis or weaker bones with reduced mass and strength, sudden mood swings, cataracts, urinary incontinence, cardiovascular diseases. Self-care tips for menopause. 70% of women have said that menopause has somehow made them feel overwhelmed with all the changes happening to their body. But following some simple tactics can make this a lot easier for you. Our target is to help women like you by giving you genuine information and quality tips that can improve your health and well being. Here are some ways to combat this biological adversity. Hormone replacement therapy, or HRT. This is sought by many women as a means to cope up with the fluctuating hormone levels. Counseling. During menopause, your mental state is affected a lot due to all the hormonal changes occurring in you. To come into terms with this massive psychological duress, you can seek the help of a psychologist who will help you deal with these overwhelming emotions. Exercising. There are so many ways that a healthy exercise routine can help you achieve. It helps you maintain proper body weight, reduce stress, and ensure proper blood circulation. Eating healthy. If you go to a doctor, the first thing that you'll be prescribed to do is look after what you eat. Maintaining a proper, balanced diet can help you deal with menopausal symptoms. Avoiding certain food. This will help you lessen these symptoms by a huge level. If you avoid food with sugary content, beverages with caffeine and alcohol, you will have an easier postmenopausal experience. Menopause can be overwhelming and sometimes even irritating. The symptoms can make your life hard, but our simple tips will help you steer through this time with ease. Menopause is not to be feared but embraced. It is like the second innings of life, and by keeping pace with the inevitable changes in your body, you can achieve wonders at home and at work. Don't pause with menopause.
Please like, subscribe, and share our YouTube channel, The Voice of Woman, and press the bell icon to stay tuned for the latest updates.